All right, the clock has struck 2 p.m. Eastern Time. Welcome to those that have already joined us. We are going to give folks another minute or so, and then we shall get underway. All right, we'll hang on here for about another 30 seconds or so, and then we can go ahead and get started. All right, let's go ahead and get started. Thank you to everyone that has joined our presentation today. We appreciate the attendance of both current care message customers as well as those of you who are simply interested in learning more about how an FQHC in Stigler, Oklahoma, has navigated the COVID-19 pandemic. Today, I'm excited to hear from Brooke Lattimore, the Chief Operating and Compliance Officer at Stigler Health and Wellness Center. My name is Thad Kalashevsky. I am a part of our customer success team here at Care Message. For any of you who are not familiar with Care Message, we are a nonprofit organization that leverages technology to help safety net organizations fulfill the essential needs of underserved populations specifically. We do this primarily with a text message based patient engagement platform. FQHCs, free clinics, and other safety net organizations have delivered over 2 million messages and counting about the COVID-19 vaccine through our platform. A few quick logistics. Please feel free to ask questions throughout the course of the presentation by clicking the Q&A button or the chat button in Zoom. We will do our best to get to everyone's questions, and feel free to pose those questions to the Care Message team or to Brooke. We are all more than happy to chime in. We'll also go ahead and share the recording out afterwards so that you can share with your colleagues. So I will go ahead and hand it over to Brooke. Brooke, take it away.
Hello, everyone, and thanks to Thad and Jessica for inviting me to participate. We're big fans of Care Message, been in partnership with them for, I think, a little over 3 years now, and have a lot of great patient success stories with it. So again, I'm Brooke Lattimore, Chief Operating Officer and Compliance Officer at the Health and Wellness Center. We are a federally qualified health center located in eastern Oklahoma, in the very rural part of Oklahoma. We're the second largest community health center in our state and the largest rural community health center. So our mission is to provide quality health care for all area residents. Like I said, located in rural eastern Oklahoma, we cover about 7 counties. We have 7 clinics, residential treatment facility, and a mobile dental bus, and about to open our second residential treatment facility for substance use disorder. So pretty broad spectrum of services that we offer: dental, optometry, medical, psychiatry, behavioral health, and pharmacy services. So we have about a little over, I'd say, between 28,000 and 29,000 patient lives that we take care of every year across all of our services. And we do use Greenway Entergy as our electronic medical records. So let's talk COVID and the COVID vaccine. I know it's COVID's definitely been on our minds over the last year. Kind of had a moment when I realized, oh my gosh, here in a few weeks, it will be 1 year since we rolled out emergency operations in our health centers. And it's just, I keep saying we've been building the plane as we're flying it ever since. But very fortunate that we have started giving the COVID vaccine to not just our patients, but to others as well. So we did, in a partnership with the Oklahoma State Department of Health, receive about 2,000 vaccines in the very end of December, just right after Christmas. And if you recall, Christmas fell on a weekend and New Year's Day fell on a weekend. So we had a lot of our team members that took vacation that week. It's always a pretty slow week anyway in our clinics. But the health department was very adamant about making sure that we vaccinated our employees first. In Oklahoma, that first phase consisted of healthcare workers, first responders, law enforcement officers, just those really on the front lines taking care of patients. So we had to wait until after the first of the year to make sure, one, that we had a proper plan in place and everybody involved in giving the vaccines was trained. It's not just the simple flu shot. There's a little more that goes into it with the COVID vaccine. And we were able to, in 2 days, vaccinate several of our employees. I was a little surprised that not everyone signed up, given what we've all experienced over the last year. But for various reasons, some couldn't get it because they had had the flu shot too recently. Others, maybe weren't in direct care with contact with patients, providing care. And so they didn't feel like it was as important for them to get it as it would even to be some, others that were, for varying reasons. But we did, make that push to get as many of our team members vaccinated as we could. And then that following week, which would have been, I think, that second week in January, we opened it up to patients or anyone that wanted it. And you want to talk about just a mass flow of patients into our clinics. We had to reroute our phones because, our existing patients, just because we're doing COVID vaccines doesn't mean that our other patient care goes away. We still have patients that need to get in, that need to talk to their providers or their care teams. And so we had to reprogram our phone system. For those that were calling specifically about the COVID vaccine, they would go to one part of our patient access center, which is like our call center that fields all calls coming in and out of our clinics. And that way patients that were existing could still reach the people that they needed to reach. So that was one thing that happened. And then we found out too, because of that delay, I need to go back and revisit, because of that delay, when we received our vaccines the end of December, before we were able to give them out, the state health department came back and said, if you don't have all of the vaccines that we gave you in arms by this certain date, then we'll have to take them back. Well, we had already, reached out to our patients to let them know they were coming. And so we did a compromise and did give back like 400 of the vaccines. I think we had initially actually received 2,300 doses and we gave back 400. So we had the 1,900 doses that we did for our employees and our patients. And then from that point on, we just gave them out just as we were receiving them. So all of those initial doses were given. It was very interesting to see, though. I had a couple of our care team members who were like, oh my gosh, we had, this couple that drove all the way from the middle of Arkansas because they heard we were giving them. And so that was kind of a challenge because, our initial push was, of course, for the people in our communities that we serve and our patients. But how do you tell somebody no when it can be life-saving? So the state health department did come back and say, no, you could only give them to residents of Oklahoma. And then, of course, I had some patients say, well, I heard my cousin over in, Little Rock was able to get theirs with us. And why can't I get mine? Because, of course, we have waiting lists. So that was a little bit of a challenge. Of course, Care Message was a huge help in communicating with those patients, letting them know when their appointments were coming, and just education on the process and kind of where we were in those phases set forth by the Oklahoma State Department of Health. I am happy to say, as of February 22nd, I probably should have ran the numbers out of our population health management system to see where we are today, but I know we had given over 4,000 vaccines by the end of February, which is pretty amazing. Because we're in a pretty rural area, and we only have 28,000 patients we take care of, so 4,000 vaccines is quite a few. um, but people were so grateful, like I said. To some is life-saving. They were ready to get back to a more normal life, as we all were and are. So the thank you letters that we got, the shout outs on social media, just the conversations that our care teams relayed to our board of directors, and which, if you know, as a federally qualified health center, board of directors are patients that use your facilities. So I think our board is just, we're happy to be a part of it, to see where we are in, that whole spectrum of trying to get back to that new normal and in COVID. But we're now doing things a little more manageable. Like I said, I think the month of January was just a whirlwind, as was February, but can't believe it's already March, but I think that's a good thing. And moving on, we do have about 400 doses coming in each week, and had just logistically to make sure we could get patients in and out. Our two largest facilities in Sallisaw, Oklahoma, and Stigler, Oklahoma, having the vaccines given out there. Since I put these slides together, actually just yesterday found out that the 3 pharmacies that we own, which are in 2 towns where we don't have those 2 larger clinics, are able to give the vaccine as well. We don't have a plan in place, making sure that we have plenty of freezer space and getting, kind of a plan for them. So that will be exciting to see how many more vaccines we can give out. So it's just, like I said, constantly changing, and we're adapting as we go. So we can move on to the next slide, though, Thad. So operational workflow, learning, and updates. So let's talk about the phone system. We had just actually put in a new phone system, thank goodness. I think that it was kind of finalized in November. And so, we only have so many people that work in our patient access center, our call center. And they were just overwhelmed. I think on an average month, they have about 15,000 phone calls that come into that patient access center. In January, they had between 21,000 and 22,000. So we had some of our registration staff that, greet the patients as they come in, move to that patient access center. And the screeners that screen patients as they come into our building, of course, checking temps, asking the questions to make sure, everybody has a mask, and getting them so they're not all piled up in the waiting room. Some of them stepped back and came into the patient access center. So we just really had to kind of revisit operationally how we were going to take care of all those calls that are coming in. And I think that now things have probably calmed down a little bit, but we do have a wait list that we are working from to make sure those patients and community members that do want it are on that list. And just kind of working through that as we get more vaccines. We never know exactly how many we're going to get. We basically get an email from the CDC and updates from the Oklahoma State Department of Health, just saying, this is how many you're getting this week. And then we just work from there. As I said, making sure that the vaccine is available for every one of our patients in our communities. So even though our clinics are a little spread out over 7 counties, most patients do not mind to drive to get the vaccine. So having them in our 2 larger facilities where we have more wait space, of course, the Moderna vaccine is the vaccine that we are receiving. And there's, that 4 weeks in between doses. Of course, once they receive the vaccine, they have to wait in the clinic for 15 minutes to make sure there's no side effects. So, and make sure that we have enough staff. And our staff is just like a well-oiled machine now. I spoke to some patients that were in my home clinic of Sallisaw that got their first dose. Spoke to them after they got their second dose, and they're like, "Man, you guys have it down now. Like, it's a little chaotic there the first time we came in, and when we came back for that second dose, you guys could tell you just had a system going." So, we're really proud of our team for just everything that they've done the last year. Of course, just lots of change, but definitely getting out there and getting those taken care of. So, next slide. So the initial rollout, like I said, we had those initial 2,300 doses. We compromised and gave up 400 so that we, could make sure that we could get those on that initial wait list. And then that wait list pretty much, I think, quadrupled in a matter of a day. But our nursing director, our medical director, our registration supervisor, which all, definitely very familiar with Care Message and use it regularly. They were kind of the key team, I would say, that managed the vaccine rollouts and continue to do so. When we first started doing this, like I said, we had just meetings almost every couple of hours just to see how things were going, and definitely meetings at the beginning and ending of each day just to game plan. As things started to move with the vaccine rollouts, not just in our health centers, but in the other health centers across the state. There's 21 community health centers in Oklahoma, and over 100 different sites across the state. Our state trade association that kind of does training and technical assistance for us, the Oklahoma Primary Care Association, they were in constant contact with the Oklahoma State Department of Health to kind of be, our liaison, finding out, as we were getting more doses in from the CDC, answering any questions. And so every Tuesday morning at 8:30, we have a call with our primary care association, getting updates on a state level and a national level. And I know that, and maybe you've heard and maybe you haven't, that HRSA, the Health Resources and Service Administration that oversees community health centers like ours, put into to plan a pilot program where instead of working with the state health departments, federally qualified health centers like ours could get the vaccine directly from the federal government through the CDC. And so HRSA picked 250 health centers just to kind of pilot this. And our sister health center in Oklahoma City called Variety Care, they are one of the largest, they are the largest in the state and have more patients than any of us health centers. They were the site that was chosen for Oklahoma to roll that out. It's going well. And so we hope that maybe with us being the second largest, that maybe we can be next, and then kind of cut out that middleman. Not that working with the State Department has been bad. It's just been a challenge when you add, more parties involved there giving directions. It just becomes a little more chaotic. So hoping that we'll be able to get them directly from the feds, and then just basically open it up, get hopefully more vaccines, and open it up to more patients, not just those frontline workers and the at-risk and the 65 plus population, which is the phase we're on now. But, we have a lot of young people that are asking, hey, when can I get mine? So anticipate hopefully that will happen within the next few weeks. So if anything we've learned, coordination and communication is definitely key. In any kind of pandemic communication, transparency, trying to coordinate as best you can with what you're given. Like I said, I can't commend my team enough for the effort that they've put into it, and just knowing that things aren't always going to go as planned. So we have our little teams that work together and are in constant communication with each other. And then, communication with our patients and care message has been just critical in being able to get those messages out. Reminders of next vaccines. And um, I don't know where you all are listening from, but we had some pretty crazy weather here in Oklahoma, as did a big part of the country a few weeks ago. Of course, right in the middle when we were trying to get several, second doses and initial doses out. And, once you puncture the vial of the Moderna vaccine, it has 10 doses in it. You have to use it within 6 hours or it's wasted. That's the last thing we want to do, is waste a precious commodity like the COVID vaccine. So just had to kind of regroup and decide for a few days that week we weren't going to give any vaccines. Our clinics actually Wednesday of that week in February, I think it was the third week in February, we shut down operations, which is something we don't ever do, because when patients need to be seen, they need to be seen. But just for the safety of our staff and the patients alike, we closed down for a day. So it put us a little behind, but we were able to get, I think, everyone that was supposed to get that vaccine on that Tuesday and Wednesday. We gave them all out on Friday. And I know in one of our clinics, I think we did like 137 vaccines in one day. So we made it work. And I think we're caught up now and just a little more manageable. So the next slide. I've already mentioned staff communication. Definitely not just communication amongst ourselves, but communication with our patients. In Oklahoma, vaccines aren't super popular with just the climate in our state. So definitely debunking those myths. You guys can go to our website. There's a pretty funny video on there where myself and one of our pharmacists, our HR director, and our medical director just kind of, debunk some of those myths in a fun way. Our pharmacist used the science. Our HR director, which actually is the most like hardcore mask wearing, he follows all the guidelines. He was the patient that, was believing all the conspiracy theories. So it was kind of funny to see him in that role, but just really, it's, I don't know, about between 10 and 12 minutes long. And we shared that with our patients if they wanted to watch it, even with some of our team members. So I just think that the more facts you can give people of all the things that they were, reading on the internet and social media, that, a chip was going to be implanted in them if they got the vaccine. We're like, oh my goodness, you have a smartphone, that's your chip right there. And then our medical director, always the jokester, was like, well, I hope if I get a chip, I get Doritos. So we're just trying to make it fun, but be serious and give the facts. I would say initially I was a little disappointed in the percentage of our team members that came forward and wanted it. And some of them had valid reasons for not getting it, but we do a virtual all team meeting with almost 300 of our staff members participate in that. And some of us gave a testimonial about getting the vaccine, and it did kind of, I think, give people a little more encouragement and faith in getting it. So I think initially it was only like 16% of our staff had got it after that first few weeks. And then it went up to about, 30 something percent. And now 43% of them have received first and second doses, which is good. We'll just continue to push for people to get it, so that, we're hoping just to do our part to get back to a normal. The communication. So not only are we working with the state and our Oklahoma State immunization inventory system, where, just because a person gets their first dose with us, life happens, maybe they move and they need to go somewhere else to get their second dose. So all that information is in that inventory system. Making sure, that we have the number of vaccines that we need to give out. And doing first doses and second doses at the same time is definitely a challenge. So making sure that documentation, of course, in healthcare is definitely key. If you don't document it, it didn't happen. But I think now is even more hypersensitive that we definitely document everything that we're doing so that not one patient falls through the crack and we get them their vaccines to them on time. So again, can't say enough about communication. That's definitely important. So next slide. Our website, so I mentioned it already, the education video. We're working with our marketing company, which is a local company that we work with. They've been great in helping us promote things on Facebook. The calls that are coming in through our patient access center. Definitely our partnership with Care Message and the HIPAA compliant text messages and just messages that are going out on education and helping debunk those myths to encourage people to get it. I didn't mention Freesia, which is kind of a key piece in us getting, especially brand new patients that have never been seen in our system, getting them registered. So Freesia is kind of a pre-visit check-in tool. It interfaces with our EMR, Greenway Energy. It's actually an energy Greenway partner. So those tools talk. And so if you're a brand new patient coming into the Health and Wellness Center system, you will get a text message or an email, depending upon your choice of how you'd like to receive it. And you can go through all of the questions, the demographic questions that are asked, insurance questions that are asked, all the social determinants of health questions that are asked, which are important, social history, medical history. And so a lot of that time-consuming work is already done before the patient even enters our facilities. So that's been super helpful. And of course, it's not for everyone. I think definitely the large majority of our patients use it. It's just very convenient and easy. You can answer it. You get a text message, a day or two before you need to be in the clinic, and then it sends a reminder if you haven't done it after, the first day you receive it. So 2 days before, and then a day before. And then, of course, if you don't want to do it when you come in, you can, use the Freesia tablet, which asks the same questions, or there's some that just don't do technology and can use paper, and our staff is there to help them. So again, more communication. The next slide. Definitely preventive care and that is this is still my part, I'm thinking, isn't it? Just want to make sure.
Yes.
Okay. Just want to make sure I'm not taking your part. The educational messages, like I said, not just because it's COVID vaccine time, which is what the topic of this is about, doesn't mean that all the other things that we do in our health center go by the wayside. So, due to the last year, screening rates are down for cervical cancer, breast cancer, colorectal cancer, all those screenings that we need to do. Immunization rates are down for our kiddos. Well child checks are down. So really just trying to get the educational messages out to our patients, encouraging them to come in a safe manner and get those necessary screenings taken care of. So Care Message has been a great partner with that. Again, dispelling any myths, encouraging them to get not just the COVID vaccine, but the flu vaccine. I don't know how it is with you guys in your parts of the country that you're in, but flu cases have been down extremely, which I want to attribute to the masks and to hopefully increased hand washing and sanitization. But that's kind of a good thing. I think we've had very, very few flu cases, and the number of COVID cases are going down. So that's hopeful. Anyway, next slide. Some challenges that we've faced. We don't know all of the healthcare workers and law enforcement officers and emergency medical technicians. We don't know all of them in our communities. I mean, we know a lot of them, but making sure that they know that they can come to us to get those important vaccines. A lot of the hospitals, which are kind of few in our rural part of the country, unfortunately, a lot of them have closed, but some of our hospitals were giving them, the health departments were giving them. But I would say, all in all, a lot of the vaccines that are given out in our communities are coming through our clinics. So, making sure that we get the word out. Obviously, word of mouth is still one of the best ways to communicate, because knowing that 23% of those initial doses were outside of our service area, not even in our state, definitely meant word traveled fast. But um, making sure that we continue to spread the word to our patients and to our community members. Of course, making sure that we have enough staff to take care of the demand, caused us to revisit and scale it down to 2 locations. Of course, with the phone system, the limitations on it, limitations, in our rural part of the country, internet is always a challenge. Fatigue, I know, you can tell on Friday after the end of a very busy vaccine week. You could tell our staff is just like, wow, what just happened? They're tired. So, um, it, not to say that the weather was great, because it brought on a new set of challenges, but having that day off in the middle of the week with the weather and the craziness of vaccines. And we were closed that Monday. I think I forgot to mention that Monday was President's Day, and actually we're closed on that day. So maybe that gave them a little bit of reprieve to kind of rest and regroup, spend time with their family, and you know come back charging hard. So um, again, the registering of patients and non-patients, and that was a challenge. How do we do that? We do have to have, of course, the patient registered in our system for the order to be placed by our providers, so the nurses can give the shot. But um, we did initially, when we first started, we're counting every one of those patients as a visit, and then we thought we're making it too hard. One, if they're a patient that's never been seen in our facility, that may or may not, of course, we hope they come back to see us, and I think a few probably have, but a lot of them aren't. That affects our quality measures. So, if they're seen one time, and we don't take care of their hypertension, their diabetes, their screening rates, that affects our quality measures. So, after those discussions with the state and with HRSA and with our primary care association, we just said we're basically kind of being a facilitator for the federal government and getting those shots out. And um, like I said, our providers have to order them in our system, but it's nurse only visits now. So our nurses work together great. And we have, of course, more nurses than we do providers. So they're able to get those out. But I think I probably touched on a lot of the challenges just throughout my conversation. But um, it's I think we'll continue to see challenges, and we'll just face them head on as they come on, and continue to have good communication and just meet the needs of our patients as we go. So, next slide. I think that's your part, Thad. So, again, thank you for allowing me to participate in this. I hope I've given some helpful information, and definitely happy to answer any questions. I do see a question on the Q&A in the chat. How many staff did you have answering only calls about the vaccine? So we have 7 team members in our patient access center, and we added 2 more that were specific just for the COVID calls. So. And you were told about your vaccine supply on a weekly basis. Yes, we get emails from the CDC and confirmation from the state health department as to how many vaccines we're going to get in that week. And typically when we get that email, they're delivered to us within a day or 2. Of course, if there's good weather. It was a little challenging. I don't think many delivery people were moving there for a few days, a couple weeks ago. So If there's any other questions, I'd be happy to answer them at the end or just in the chat. I can monitor that and answer them as well. So thanks again.
Thank you so much, Brooke. Thank you for addressing those questions in the chat. And thank you for sharing with us the sort of operational changes that were made to your workflow and approach to patient engagement as well. I just wanted to take some time here before we officially move into Q&A to highlight a few examples of how we've seen health centers leverage bidirectional text message communication to save time for staff that would otherwise be spent on the phone. So the example we see here is from a care message customer in New York. And what they're doing here is essentially refining their wait list by removing anyone who responds no and letting patients who do still need a vaccine know that they will be contacted as soon as a dose becomes available. This type of mass messaging campaign would live in our outreach feature. And you can see a fantastic response rate, over 80%, with 44% indicating that they do still need the vaccine and 56% indicating that they do not, hopefully because they were able to receive it elsewhere. For those that tell us that they do still need it, we'll want to follow up and get them an appointment, obviously. So rather than use the outreach sort of campaign style feature, we would move into Messenger, our one on one texting feature. Here, we've created a template that references both the patient and staff member's first name to make the message feel more personal. And we are, quite simply asking for the patient to let us know when they would be available for their vaccine appointment. A conversation like this can be facilitated over text to either completely replace outbound phone calls or to more likely supplement your existing efforts to get a hold of your patients. Again, the idea here is really to save staff time spent leaving voicemails and fielding the subsequent inbound phone calls. All of that back and forth instead is in one centralized location. You may notice that the last text here lets the patient know to expect a reminder text the day prior. And if you are already a care message customer, we have created and published a COVID vaccine appointment reminder template to your account. You can find it in the appointments feature under templates. So please do feel free to make use of that. And if care message is integrated with your EHR, reach out to your customer success manager and they will be able to have your vaccine appointments mapped to this template, which provides instructions and emphasizes the importance of the visit. And in our third and final example here, we are taking steps to try to address any hesitancy that patients may have previously expressed. And Brooke touched on this a bit. We've seen lots of health centers send yes or no questions to patients asking if they're interested in getting the vaccine. And for those that respond yes, the next step is self-explanatory, but those who respond no, the next step might be a bit unclear. This is a multiple choice outreach question that could be used once we've gotten a good sense of those that have already expressed that hesitancy or aversion. What we're trying to do here is understand what our patients' top concerns are, provide them with some additional information, and give them a phone number to discuss further. This might be a good place, instead of a phone number, to place a link to your website or landing page, like Brooke had mentioned, Stigler has, with information about the COVID vaccine. So if you are a current customer of ours and you have any questions about using Care Message for these sorts of campaigns, please feel free to reach out to your customer success manager. We're happy to discuss that further with you. And if you're not yet a Care Message customer and you can see how this type of engagement with patients might benefit your organization, please go ahead and reach out to Jessica Day at jday@carematch.com. at caremessage.org. We will go ahead and take the last 5 or so minutes here to answer any questions that you all might have. I think, Brooke, I think you handled all of the ones that were already in chat. But I did have a question about something you had mentioned. Um, what kind of information and updates are you typically receiving from the PCA and state DPH? And are there any specific questions that FQHCs should be asking their PCA or departments of health?
I mean, of course, I think the big question is how many doses are we getting and when, just so that we can plan. I think a lot of the questions, just being on those calls with the other health centers and our PCA that we do every Tuesday morning. So the PCA gets information from the state and then more or less passes it on to our teams. And typically on those calls are the CEOs or COOs or nursing directors, medical directors of the various health centers. I think that just your questions to ask, like I said, it's just how many are we getting and when, so that we know how to plan as quickly as possible to administer as many as we can. And making sure, that we monitor, our team members, our internal team members, to make sure that we have enough staff to give them out. You can't have 137 patients come in one day if you don't have all your staff readily available there. We've even talked about doing some Saturday clinics if we need to, once we get, hopefully we get more than 400 vaccines a week. We would love to get 1,000 and give as many as we can. But that'll take careful planning. So.
Awesome. Thank you. Um, I see some questions coming in through the Q&A here. The one question is, what is the turnaround time from when you choose your population to when the text message goes out? With Care Message, you have full control of when that message is delivered. So you're able to save templated messages that you might use repeatedly, and then deliver those to a specific cohort at your a time of your choosing. So you're able to kind of pre-schedule those messages out, and they will be delivered at whatever time you determine. There's another question here. How does Care Message work with the clinic's EMR system? So we do have the ability to integrate with a number of the kind of most popular electronic health records with an HL7 integration. So essentially, if you book an appointment in NextGen or Epic or another EHR, the appointment will also be scheduled in Care Message, and a set of predetermined messages, text messages, will go out to remind them and provide specific instructions about the particular appointment type. Let's see. I see another question here from Claire. How are you able to reach out to the populations in your community falling under the current phase if you have exhausted your wait lists, Brooke?
Yeah, so I don't know that our wait list will ever be exhausted, which is good and bad. I'm hoping that if we are able to get the vaccine directly from the feds through CDC, that we don't have to follow the state Department of Health guidelines. We can just give them out to anybody that wants one. Which will present a new set of challenges, but we'll be ready to face those. So I think that we'll just, keep pushing forward. So.
Thank you. Yeah, and just one final question to kind of round it out here. I'm curious how, Brooke, you guys are thinking about approaching patient education around the vaccine as that kind of initial demand over the course of the next few weeks and months is met, and we're kind of down to folks that haven't received the vaccine and might still be hesitant or averse to getting it. Do you think that it's going to be important as we kind of proceed through the various phases to kind of continuously provide that sort of education?
Yeah, I think so. I mean, I don't know that you'll ever be able to convince everyone. We know that's not
Yeah.
going to happen. But, I think kind of like we did with our own employees, some of us team members that have, been around a long time that I hope they feel they can trust, kind of, just giving our testimonials, like our CEO, our billing director, our behavioral health director, our HR director, myself. Um, just saying, hey, this is safe. This is what we're doing our part. So maybe even, um, we could set up. I see there is going to become a time, obviously, um, when we have exhausted that wait list, and um, I think it'll be some time before it happens, maybe this summer, and then who knows, maybe in the fall we have to start all over again. I'm not sure how that's going to look. But maybe, I think people trust those that they're closest to, and, maybe even having some patient testimonials if they're willing to do so. Any other ideas out there, I'd be certainly be willing to take a look.
Yeah, I really do love that idea of sharing those testimonials. First with the providers and nurses that have already gotten the vaccine, and they can kind of tell people and be you know be straight up about what it was that they experienced. If they did experience side effects, to kind of share those and say that it's actually a good thing that you're experiencing side effects. It means the vaccine is working. So I really do like that approach.
I've
Um,
heard of two, and just that's just me hearing. There may be more. Definitely would like to see those numbers, but um, people hearing how tough the second dose was. Two people that I've heard of that said, "I'm not getting my second dose. It's just not worth
mm,
it." But and I'll tell you, I didn't feel great after my second dose for probably about 36 hours. I mean, I didn't feel horrible. It just was kind of uncomfortable, but my gosh, so worth it. So no
mm,
pain, no gain, right? So
that's right. That's right. Well, thank you so much, Brooke. And thank you to everybody who submitted questions and attended today. Like we said earlier, we will share out the recording of this session. So please do feel free to forward that along to anyone else that might be interested. And keep an eye out in your inbox for invitations to our follow-up webinars as we continue to explore our customers' journeys through dealing with the pandemic through a number of scopes and various topics. So thanks again, Brooke. Really appreciate it. And thank you to everybody who attended.
yeah, thanks all. Stay safe and take care. Bye bye.
Thank you. Bye-bye.